Hi, my name is Maritime. My number matric is SC8028. I would like to explain you guys about the personal protective equipment. So, check it out. PPE want to minimize exposure to hazard that cause serious workplace injuries and illness, where the injuries and illness may result from contact chemical, radiological, physical, electrical, mechanical, or other workplace hazards. All personal protective equipment should be safely designed and constructed and should be maintained in a clean and wearable fashion. PPE includes such as gloves, safety glasses, shoes, earplugs and mouth, hard hat, cover and full body suit. So, I would like to introduce us about the head protection. This is head protection. Example of head protection, which is safety helmet, also known as a hard hat, essential pieces of PPE designed to protect the head from injuries caused by falling projects, impact with stationary objects, or electrical hazards. So, this is example of the PPE. We have the hard hat and we have the shoes. So, now I want to explain to us about the bump cap. Bump caps are type of head protection primarily used in work environments, but they are not designed to protect against impact force as much. They are designed to protect against abrasions, cuts and scrapes. And bump cap is made from foam or fabric and often have a visor. So let's go to the earplug. So guys, earplug is to protect the ears from damage caused by loud noises and reducing the sound volume. Lastly, to keep water out of the ear canal during swimming and water sports and protect from the pain caused by airplane cabin pressure change. So we go to the earmuff. Earmuff is designed to protect the ears from excessive noise pollution, dust or temperature variation, especially cold. And earmuff is made of the thermoplastic and sponge and are shaped like a pair of cups. Okay guys, do you know it? This is a safety glasses which is crucial for the protecting the eyes from various hazards in different environments and serve multiple functions, preventing chemical exposure that can burn or damage the eye tissues, and lastly, have UV protection which can cause long-term eye health. And lastly, for the PPE, we have the blowtorch. With the blowtorch, these glasses are not correct filters for outwarding, but are essential for protecting the eyes while working with a blowtorch and prevent irritation of the eyes by dust, wine, or other hazards. That's all. Thank you.
Hi, my name is Narayana binti Abotman and my matric number is SC8295. I'm from Maritime Management Program. We are from Group 5. First of all, in task 2, I'm going to talk about what is confined space and a crusher safety procedure to enter confined space about a ship. What is confined space? Okay, next. Confined space on a ship is any space that is large enough for a person to enter but not designed for continuous human occupation. For example, tank, hold, and cargo space. This area often have limited access, bad ventilation, and potential hazards. A crusher safety procedure to enter a confined space about a ship. Before entering, a certain equipment is required to ensure safety when entering confined space, such as wearing PPE, use gas detector to monitor oxygen level and detect hazardous gas, and bring communication device to maintain contact with the outside team during the operation. Next step to entering confined space. Okay, now let's go over the step to enter confined space. First step are testing and ventilating. Second, setting up ventilation. Third, issuing entry permit. Fourth, entering space. And lastly is monitoring. Okay, that's all from me. Thank you for watching.
Assalamualaikum warahmatullahi wabarakatuh, and hi everyone, my name is MNS3143. My matric number is SC7523.
And hi, my name is MNS3143. My matric number is SC7454. We are from Maritime Management student.
And we're from Group 5. We explain to you guys about the Task 3.
So now it's time to show to you guys about the simulation of the Task 3. Let's go.
So, to help our team member, we need to do immediate action. We need to assess the situation. Before entering the tent, we make sure the tent is free from toxic gas. Second, we can call for help. We can call our team member, can use a communication system to make sure they can reply faster. Other than that, do not enter alone into the tent. This is because if something bad happens, other member can help us. The last one is prepare for rescue. We make sure the PPE is in a good condition and can use to help the patient such as lifeliners.
Next, regarding safety and first aid procedures when entering a tent, particularly in a potentially hazardous environment. The next point is enter with caution. You need to assess the environment before entering any confined space such as a tank. It is crucial to assess the surrounding area for potential hazards. This includes checking for first toxic fumes, which is look for signs of gas leaks or fumes that could be harmful. If available, use gas detection equipment. Second is structural integrity. You need to ensure that the tent structure is stable and does not pose a risk of collapse. The third is ventilation, which you need to confirm that there is adequate ventilation to prevent the build-up of harmful gas. You also need to maintain a low profile. When you enter the tank, keep your head low to minimize exposure to any harmful substances that may be present in the air. This can help to avoid inhaling toxic fumes and reduce the risk of injury from overhead hazards. Next, check for breathing. You need to reach out to your friends. Once inside or upon reaching your friends in distress, it's vital to check their condition quickly. This includes verbal communication, which you need to call out to them to see if they respond, and physical assessment, which means that gently shake their shoulder or take them to gauge responsiveness. If your friend does not respond, please check for breathing. Look for chest movement, listen for breath sounds, or feel for breaths on your cheek. If they are not breathing, immediate action is required. Afterwards, administer first aid by performing CPR. If your friend is unresponsive and not breathing, you need to call emergency service. Positioning, which is place them on their back on a firm surface. Compressive technique and rescue breath if you are trained. Please continue perform a CPR until emergency service arrive or until the person shows a sign of life, such as a breathing movement. Last one is use a rescue equipment by utilize rescue harness or equipment. If your friend is unable to assist themselves, please assess their condition, which determine if they are conscious and able to follow instruction. If they are not responsive but breathing, prioritize getting them out safely or use a rescue gear, rescue harness or lifting equipment. Please note that to ensure safety during rescue, while using rescue equipment, you need to communicate clearly by provide a clear instruction to your friend if they are conscious and able to assist. And the second is teamwork. Work with others if available, because having multiple people can ensure a safer and more efficient rescue. By following these steps carefully and methodically, you can help ensure safety in potentially dangerous situations while providing an effective first aid when needed.
From our group, thank you.